Dr. Douglas, thank you for coming to SAIC 2016, and I appreciate a lot your visit, your attendance at this Congress. What would you list in question of frequency, but not of clinical importance, which are the main causes you see in your daily practice?
Well, first of all, thank you very much for inviting me. It's my pleasure to be here in Mexico. And we know from many studies, many statistics, mostly from the pet insurance industry, that the most frequent reason for a pet to visit the veterinarian for an illness is skin disease, and especially pruritic skin disease, and also especially ear disease. These are very common and very frustrating problems for all veterinarians.
What is the most important if depend of the technical for that disease that make a pruritus?
So we know that pruritus is caused by many different things, and our most recent understanding stresses that cytokines can be a very important cause of pruritus when the pruritus is caused by allergic disease. Many times we see cells releasing cytokines, many different cytokines that stimulate the inflammatory response and stimulate pruritus. So there's a lot of new findings about allergy and pruritus. Many of these point to the important role of cytokines.
Okay. This information go to the next question. That problems can you be highlighted? We speaking with the pet owner about the problem of allergies.
So when speaking to a pet owner about allergies, it's very important to set the owner's expectations carefully. We always must discuss with the owner the fact that allergies are a lifelong problem. Allergies are a problem that cannot be cured, but they can be controlled very effectively, especially with new findings, new medications, new therapies. So it's very important to tell the owner that allergies can be controlled effectively, but it may take some time. No two dogs are the same. It may take different treatment protocols and a different combination of therapies to create the optimal resolution of pruritus.
In this Congress,
Yes.
you're talking about the pathophysiology of the pruritus, of the dermatitis atopic. You consider is important today speak of this pathology with the veterinarians?
Yes, it's very important for veterinarians to understand the pathophysiology of allergy. We have many new findings about the pathophysiology of allergy, and these findings stress that allergy is a very complex process. It is a multifactorial process. It involves many different parts of the immune system, the epidermis, an interaction with the nervous system. So there are many aspects to this allergic response. And this brings us to the importance of thinking about a multimodal approach to treating allergy. So it's critical that veterinarians understand this in designing their treatment protocols.
In the framework with the Congress, launch a new therapy. The name is Upquel. What is your opinion in this topic? Because I think the veterinarian maybe have a problem with the change, the idea with the treatment of the pruritus or the itching.
Yes. Well, I think it's a very exciting time in veterinary dermatology and allergy in dogs. It's a very exciting time because our new understanding of the pathophysiology of itch has led to development of new treatments. And we've always had a problem in treating pruritus in dogs because we have had some treatments that are effective, for example, corticosteroids, but these effective treatments often have side effects, adverse effects, that make them unsuitable for long-term use in dogs. So there's always been problems with creating long-term benefit without long-term adverse effects. And these new therapies, such as Apoquel, give us the opportunity to provide relief for pets with pruritus with a much lower chance of side effects. And because allergy is a lifelong disease, veterinarians have to think that they must treat this disease for 5 years or 10 years. And so we need to think about changing our therapeutic approach to something that is more effective and safe over the long term of the dog's life.
Thank you, doctor. But I appreciate a lot your take a time for this interview, and I hope to see you soon in the next Congress.
Thank you very much. It's been my pleasure. Thank you.